That coccyx pain after birth and bruising to the tailbone, incredibly common, and yet literally next to no research on this area. If you yourself had coccyx pain, let me know in the comments below what helped you and how long it lasted for. For the majority of women and people, the coccyx pain will disappear within a few days to a few weeks after birth. We as women are continually let down by the lack of research, and yet it's probably one of the most common discomforts and pain after having had a baby that lots of women and people will tell me about as a midwife. And yet, the research studies out there are like literally nothing. So whilst cuts are not really possible in relation to your tailbone, the bruising, the pain, the discomfort, particularly if babies are back to back and born, for example, if there's been forceps or ventouses, we tend to find more as midwives that women and people will complain of that bruising feeling, like they can't really sit down on their bottom, like everything's heavy, like everything hurts. And that is an incredibly common postnatal recovery symptom of childbirth. What I find as a midwife that often helps is side lying, so being off of your bottom so that you're not sitting for long periods of time to try and relieve that coccyx pain and discomfort. Things like paracetamol and ibuprofen can work really well too. For some people, they may need some more hands-on physiotherapy type treatment to help relieve it. From a Google search only, it happens in up to 10% of all vaginal births. However, the limited research that exists out there, we need far better research in this area to know exactly what the risk factors are, because the case studies are really small, for example, but also to know what the best treatments are. Lots of people will see a chiropractor or an osteopath who is trained in pregnancy, and for some people that can really help relieve the symptoms after birth, particularly if it's been related to any sort of pelvic girdle pain during pregnancy. This is literally one of the only studies I can find on coccyx pain. In this study, they found that over half of all women with coccyx pain after birth had had an instrumental birth, such as a forceps or a ventouse birth. For most of these people, they found that the pain started as soon as they adopted the sitting position after birth. Now, there are some patient information leaflets out there because this is such a common thing that we tend to see after birth. For the majority of women and people, it can take up to 6 to 12 weeks for the coccyx to heal and for the pain to resolve. I personally feel this is an underreported pain because the people who are referred into physiotherapy services are usually the people who have ongoing continual pain, and not the people who will genuinely say after birth, I've got really bad coccyx pain. It all feels like it's all lower down in my coccyx and my bum. So the prevalence is probably far higher than the actual stats that we've got because this is an under-researched area. What can make it worse? So prolonged sitting, bending, lifting, climbing stairs and opening your bowels, and some can feel increased pain during menstruation. Things that can help is not being on your bum where you can, so trying to side lie, for example, side lie to feed your baby. U-shaped or gel cushions can also really help. Postural correction, so making sure that you are sitting upright to relieve the pressure on the coccyx. Cold therapy such as ice packs can be really useful and beneficial. Stool softening medication if it's aggravated by bowel movements, so always see your GP for any advice. And physiotherapy, and this Royal Barks leaflet has got some really good pelvic floor exercises and exercises to be able to help relieve the pain. Sometimes seeing a women's health physio can be really beneficial for people who have got this coccyx pain, as can seeing an osteopath or a chiropractor who's trained in pregnancy and postnatal. Coccyx pain is incredibly common after birth. Don't sit in silence. There's lots of treatments that you can have, both short-term and longer-term, and women's health physios, chiropractors and osteopaths can really help if it's ongoing.